Over-the-counter medicine may not require a prescription, but they can be dangerous if the wrong dosage is taken or taken for too long. Here with what you need to know about over-the-counter medicine is Touro Family Medicine physician Dr. Meredith Maxwell. And thank you so much for joining us. And this is really a biggie because so many people take over-the-counter medicines and don't tell their doctor because they think it's no big deal.
That is exactly correct. We can't counsel you on what we don't know. Just because it's natural or over-the-counter doesn't mean it can't hurt you or your chronic condition. So it's really important to let us know what you're taking.
So tick off a few of the dangers, like for diabetics, if you're taking, Tylenol, ibuprofen, the normal over-the-counters that we think are okay. Talk about how it affects some people with different conditions.
Okay, so ibuprofens can affect high blood pressure. It actually can raise your pressure in certain situations. Actually, heart failure patients need to be very careful with those medications. Diabetics need to be careful of things with lots of sugar in them. Blood pressure patients need to take specific over-the-counter cold medications. So really, when you come in, it's a good idea to say, hey doc, what can I take in case I get sick? Or call us and ask us, because I would much rather prefer that than you just kind of guess.
Yeah, and the way they interact with other medications, like if you're taking one high blood pressure medicine, you shouldn't take another supplement or something within the same time span. What does it do?
So a lot of times it can exacerbate the condition that you have already. For instance, Coumadin patients or people on anticoagulants need to be really careful about aspirin. If you're taking an aspirin already, you need to be careful about aspirin-containing products. That can make you bruise, bleed out a little bit easier, can make things very dangerous. So, it's kind of hard to guess every single thing that you can or can't take. It's so tailored to you individually. So it's really important that you tell us, even if it's over-the-counter or natural, tell your doctor what you're taking or what you take when you get sick or have aches or pains or something like that.
Right. Okay, when it comes to over-the-counter medicine, they sometimes don't give a dose for children, and you may overdose your kids. You have to be careful. How do you find out how much is okay for your child?
So I like to tell people when they go in, bring their over-the-counter medications to their pediatrician and get them to write on the bottle at that point in time how much is safe for your child. It's a good idea. It can get kind of tedious trying to calculate, and it can get very confusing. And if in any question or you haven't been in a while, just call your pediatrician's office, because it's much safer than doubling the dose or guesstimating. You can really harm your child by doing that.
You know how some people take a handful of their pills that they need to take for the day all at the same time and then may throw in an aspirin or something too? That's not good, is it? Are you supposed to space out your medicines?
It just depends on really what you're taking. So, those Monday, Tuesday, Wednesdays with the AM, lunch, PM are really important. And if that is special for you, your doctor kind of will let you know. So it's really specific to the medication.
I'm sure you've seen emergencies before where people may have taken over-the-counter and their medicine at the same time, and it had a bad result.
Yes, all the time, actually. You can spike sugars, you can spike pressures, you can go into heart failure. Another thing I wanted to mention is parents, don't tell your kids to take the medicines like candy, because one day if they see those medicines, they'll be like, ooh, candy.
Yes.
So that's not a good idea either. So really keep your medicines safe, keep the bottle caps on. I know those child-proof caps are kind of a pain, but it's for a reason.
We want to take a look at a live picture right now.